Assalamu alaikum fellas, welcome to my channel Epitome of Creativity. How are you? Hope you're staying safe and enjoying yourself in quarantine. Don't let your morale down during these times and be productive. I couldn't make videos for you guys recently, but anyways, I thought this video will be a surprise for you. So without further ado, let's study some anatomy. The topic for today's lecture is clavicle. The famous things like it's the beauty bone, it's your collarbone, and in this etc., blah blah blah. The fracture to this clavicle is very common, especially in athletes. The clavicle, it's an elongated, lengthy, S-shaped bone, okay, that rests horizontally over the manubrium of sternum and across the acromion process of scapula. It's called the collarbone. And what is the acromion process? This is sternum, this is acromion process of scapula. This part is known as acromion process of scapula, and the part of the clavicle attaching to the acromion end is called acromion end of clavicle. Okay, so basically clavicle is connected to scapula through this to support the body overall, and it rests on the manubrium of sternum. The manubrium is the part above the sternum. Okay, it is an important part of the skeletal system, and it also rests above the first rib, the rib cage, above the rib cage. And then what clavicle serves as a connection between? Can you guess? Any guesses? Write down in the comments below. Well, it's the only long bone. The clavicle is the only long bone that rests horizontally in the body. It's not like the rib cages are not long bones. Don't confuse it with it. The rib cages are not long bones. The clavicle is a long bone, and among all the long bones, the appendages and all that, all those long bones, it's clavicle that lies horizontally. And then what's the connection between, clavicle serves as a connection between what? It's the answer is axial skeleton and the pectoral girdle. So pectoral girdle are the shoulders, and then there is the, did you get it all? Okay, moving to the next point. It acts as braces for the shoulders. Braces are used to intact the teeth, align the teeth, to arrange them in proper shape and lining them up and all that stuff. So we can say that they act as braces for shoulders. The clavicle aligns the shoulders. If there is no clavicle connected to your shoulder will drop down, and we will experience lacking sense of stability. And so that states that the basic purpose of clavicle is to transfer the weight from the upper limbs to the axial skeleton. It's connected to sternum, which is the starting point, or we can say the medial point of axial skeleton, and it connects the shoulder. The acromion end is the upper limbs are starting from acromion end. So that states that clavicle transfers weight from upper limb to the axial skeleton. Short, it serves as a connection for the skeleton. Means it holds the appendicular and axial skeleton together, connecting the two. Now moving on to the next point. Due to the clavicle structure, there are only two planar, means it is dry arthrosis articulations that can be found in the clavicle. Now diarthrosis means two planar movements. It means that the clavicle can move in two planes, two joint plane. It's also called as a double plane joint, and hence called the double joint bone. The next point is we'll discuss the joints. The first joint of the clavicle makes is the acromioclavicular joint. The clavicle makes two joints. It only has two ends, so it makes two joints. And the second is sternoclavicular joint. Now talking about the acromioclavicular joint, where it is found. It is found between the acromial head of clavicle and the acromion process of scapula. I showed you the process of scapula. The acromial head means the part of clavicle that is connecting to the acromion end of scapula. Here, as you can see, this is the acromion end of clavicle, and this is the acromion end of scapula, and the joint that is being made is acromioclavicular joint. So this is the acromioclavicular joint. Repeat it with me. How many joints are there? Acromioclavicular and sternoclavicular. So now talking about sternoclavicular, it is present between the sternal end of clavicle and the manubrium of sternum. The sternal end of clavicle is the part that rests above the manubrium of sternum, and manubrium is the upper portion of sternum. The upper portion of sternum is called manubrium. Okay, so now this is the end of clavicle, that is sternoclavicular, and this is the manubrium. I'll just write it down for you. So the joint the clavicle is making with the manubrium is called the sternoclavicular joint. Just revise the names of the joints again and where they rest. Okay, so now moving on to the next point, we'll talk about muscles that attach on the clavicle. There are total 5 muscles that attach on the clavicle. The first being the trapezius muscle, and then the second is the deltoid muscle, and then the third one is sternocleidomastoid muscle, and then there is the fourth one, pectoralis major. It's so common, I've just heard this name so many times. Pectoralis major, pect major. And then the fifth one is subclavian muscle. It's above the subclavian groove, that is okay, we'll discuss it later on. Now let's discuss where the muscles are found. So trapezius muscle is found, it comes from the posterior side of clavicle, from the back, and it attaches to this end. Okay, and then about deltoid, it comes from the anterior surface on the front. Anterior means front and posterior means back. So then sternocleidomastoid muscle, it is found on the superior surface of clavicle. It's the upper surface of clavicle from where the muscle attaches. And then there is pect major, it comes from the anterior surface then again. And then there is subclavian muscle, it comes from the inferior, from the downward side of clavicle on the subclavian groove. Let's discuss the acromioclavicular joint in detail. Now about the movement it allows slight gliding movements. Slight gliding movement about the shoulder region. Let's suppose this is your clavicle and this is your shoulder, and you can slightly move your clavicle. You can experiment it with your own clavicle. Okay, so Now, the shoulder has a fibrous capsule around it. It's a synovial joint, and so there's also synovial fluid inside it. The shoulder joint is surrounded by an articular cartilage that makes a capsule around it to give it a protective covering, since it's a synovial joint. So, the properties of synovial joint, that is why it has a capsule around it. Now let me just draw a diagram. This is your clavicle and this is the shoulder, and it is covered by a cartilage. The one I drew outside is the articular cartilage, a protective covering for the joints. And firstly, when there's an infant, it is hyaline cartilage, and once he grows into an adult, it changes into fibrous cartilage. This cartilage is present around here somewhere over the scapula and the clavicle, the connection in between the shoulder. Let's talk about the ligaments in the acromioclavicular joint. So the name suggests that there is an acromioclavicular ligament that is present around here in the acromioclavicular joint. I drew this diagram for you, and this is the ligament that attaches the acromion end of scapula to the clavicle. The acromioclavicular ligament forms a strong connection between the clavicle and the scapular acromion, which restricts movement above the clavicle at its acromial end to prevent its dislocation. Okay, let me just write it down for you. Let's just review it for the last time. So this is the acromioclavicular joint. This is your scapula, this is clavicle, and this is the part where acromioclavicular ligament plays its role in holding both the clavicle and the scapula together. So in this way, it comes from here somewhere and connects the acromion process and clavicle together. That's it. Now moving on to the next joint, that is the sternoclavicular joint. We'll discuss it in detail now. We just had a brief intro to it before. Now it's on the medial end over the sternoclavicular joint. Let's see it in detail. As we discussed earlier, sternoclavicular joint is present between the sternal end of clavicle and the manubrium. This is manubrium, the upper part of sternum, and this is the clavicle. The joint, this part is the sternoclavicular joint, where clavicle is connecting to the manubrium of sternum. You see, it's connecting the appendicular and axial skeleton together. Sternum is a part of an axial skeleton, and clavicle connects the appendicular and axial skeleton together. In this way, it anchors the whole body, whole skeleton. And secondly, sternoclavicular joint joins the clavicle and scapula to the axial skeleton. It's the clavicle bone that serves as a connection between the scapula and the axial skeleton. This is your scapula, and here this was the acromioclavicular joint, and these are the ribs. In this way, it is connecting the scapula and axial skeleton directly, or you may say indirectly. The sternoclavicular joint allows a variety of limited movements. Some of these are protraction and retraction. Then there is depression and elevation, and some slight rotation also. Okay, let's suppose this is your clavicle. Move your clavicle, like you can move it downward, elevate it, protract and retract it. Just do it on your own clavicle and you'll see. And there is some slight rotation, you can experience it. Then we'll talk about the cartilage. Like the acromioclavicular joint, the sternoclavicular joint is also surrounded by an articular cartilage capsule. Okay, here there is a capsule. The cartilage makes a capsule around sternoclavicular joint. Let's make a diagram to elaborate it. So this is the clavicle, and this is the sternum, and there is a capsule of articular cartilage surrounding the sternoclavicular joint. Inside there is a fibrocartilage articular disc that creates a clavicular and a sternal synovial cavity. You can see there is a cavity here, this one. Cavity that is made by the fibrocartilage disc around the sternoclavicular joint to provide it mobility. Call this cavity the clavicular and sternal synovial cavity. Let's move on to the ligaments of sternoclavicular joint. And there are two ligaments. The first one being the anterior interclavicular ligament. Inter means inside, and it's inside the clavicle. Not the inside the clavicle, inside the joint. It's on the superior surface of the joint, the upper part of joint. And this ligament is responsible for preventing dislocation of the clavicle upon shoulder depression. When we just depress our shoulder down, it just prevents dislocation. Which ligament prevents dislocation? Anterior interclavicular ligament. Let me just correct that. Dislocation of clavicle from shoulder joint. It's the main sentence. Now let's discuss the second ligament, that is posterior costoclavicular ligament. It runs from clavicle, posterior means backside, and it runs from the backside of clavicle and from the middle and first rib to the clavicle. Here it's from the first rib and from the middle one to the clavicle. We can say the medial surface of first rib. It prevents the dislocation, clavicle dislocation upon shoulder elevation. We can see the main difference between these two ligaments is, when it elevates, and when it depresses. This is your clavicle and it is elevating and depressing. So we can say that it prevents clavicle dislocation upon elevation, and anterior interclavicular ligament prevents dislocation upon depression, while posterior costoclavicular ligament prevents dislocation upon elevation. That's the difference between these two. Now let's study the bone extremities of the clavicle. This is the acromial end, and this is the sternal end. And now we'll see the inferior side. This one is the inferior side of the clavicle, and this is the superior side of clavicle. Now see some important features of clavicle, like the bone extremities of the clavicle, or markings you can say. Now let's discuss them. First of all, we'll talk about the extremities of clavicle. Extremities are also called the ends of clavicle. So how many ends of clavicle are there? That's obvious. Two. The two ends are acromial and sternal ends. Here this is acromial end, and this one here is the acromial end, and it is flat. It is distinguished by its flat characteristics. It's actually referred to as the lateral third of clavicle. Acromial end is the lateral 1/3 of the clavicle. Lateral, and this is medial. Lateral 1/3 of clavicle is acromial, flat end. And then there is this sternal end, which is round. It's like sort of a round shape, not a flat one. So it's also called since we called it lateral acromial end, it is called medial end, medial sternal end, and it is 2/3 of the clavicle, and it's round in shape. It's called medial 2/3 of the clavicle. It's not so difficult. Just remember that sternal is 2/3 and the acromial is 1/3 of the clavicle. Each bone has a unique bony landmark, each end, depending on whether the superior or inferior surface of the bone is viewed. Okay, so if it's medial or lateral, superior or inferior, these points are considered for a bone to be distinguished. Since this is medial and this is lateral, medial is round and lateral is flat. You need to remember these points. Sternal end is 2/3 and acromial end is 1/3 of the clavicle. These are just the points to remember to distinguish the clavicle from other bones. Now we'll discuss the superior surface. It is smooth and it doesn't have a rough appearance. It is smooth, with surface S for superior and S for smooth. Then the inferior surface is rough. It has some lines and markings. There's a this is a groove, and these are the lines, some rough lines which distinguish the superior side from the inferior. Now we've seen this, it is smooth. We'll discuss acromial facet, that is on the superior surface of clavicle. It can be seen at the far posterior edge of the acromial end. It appears as a small flattened oval surface and enables the clavicle to articulate above the acromion of the scapula in the acromioclavicular joint. It's here somewhere. and it enables the clavicle to move around the acromioclavicular joint. It helps in the mobility. I'll write it down for you. Let me just elaborate it for you by drawing a diagram. So this is your scapula and this is the clavicle. Okay, I'm actually showing you the acromioclavicular joint. This diagram, just don't mind diagram, by the way. This is the acromioclavicular joint that the clavicle and acromion process of scapula make together. Here, the acromial facet allows the clavicle to move around. It gives it mobility so that it can move. Just move your own scapula and you'll see. So this was the superior surface. Now we'll discuss the inferior surface of the clavicle. There are, as we discussed earlier, there are lines and markings on the inferior surface. These are actually sites for ligament and muscle attachments. Here, we talked about earlier, lines are here and muscles and ligaments attach here. Obviously these lines make it rough. Actually, the bony landmarkings are divided into total of 3 bony landmarks. Furthermore, first one is the sternal facet. In the superior surface we discussed the acromial facet, but in the inferior surface, what is it? It's sternal facet. Just remember the difference between the two, that the facet is different. And then the second one is costal tuberosity. Third one is the conoid tubercle. Just need to remember these 3. You can just abbreviate it as SCC or CSS. No, CSC, whatever. These 3 are the differences. Now we'll discuss sternal facet in detail. So what actually it is at the far edge of sternal end. This here is the sternal end, and on the far edge of here somewhere sternal facet is found. Okay, here on the sternal end, and it is triangular in shape. It has a tip on the posterior side. Posterior means back and anterior means front. There's a base on the front of it, a tip and a base. It's like you can draw a perpendicular thing perpendicular along a base. It's also triangle shaped and present in the sternoclavicular joint. The acromial facet was present in the acromioclavicular joint, and it is found in the sternoclavicular joint. Let's elaborate. This is the sternoclavicular joint. This is the clavicle and sternum. And so it joins the sternoclavicular joint. Now let's discuss costal tuberosity. It's located at the sternal end of the bone, again the sternal end. It is a broad, rough surface. Remember the difference between costal tuberosity and sternal facet? Costal tuberosity has a broad, rough surface, and it is 2 centimeters in length. It might come in the MCQs. It is the site where costoclavicular ligament attaches. The name shows it that it is costoclavicular and costal tuberosity. It is rough on the inferior side as we discussed earlier, and broad and 2 centimeters in length. Now let's talk about the conoid tubercle, which is found more laterally towards the acromial end. It is the first one on the inferior side to be found on the acromial end. It is also rough eminence found where the flat portion of the clavicle meets the tip of the pyramidal sternal end. Again, it is rough, and here it's shaped like this. Here on the acromial end, on the rough surface where flat surface is found. So it is actually here on the flat surface. Just to remind you guys again, I am repeating it. It is found more laterally towards the acromial end. If you suppose this is the sternum, okay, let me just make it clear for you. So this is the pyramidal sternal end. Pyramidal sternal end and the flat surface of acromion process meet. This we can distinguish it from this way, that it is on the sternal side but on the acromial end. So what we got here, another point found where the flat portion of the clavicle meets the tip of the pyramidal sternal end. In the costal tuberosity, we discussed that costoclavicular ligament attaches, but in conoid tubercle, the name shows it, conoid ligament attaches. Conoid ligament attaches here. These are just the points for conoid tubercle, and now let's move on to the muscles that are attached to the clavicle. Muscle attachments. There are a total of 5 muscles that attach to the clavicle from medial or lateral or posterior or anterior sides. That depends on the muscle actually. So there are actually 2 muscles that are attached to the lateral third of the clavicle. First one, the lateral third, is this part. This is the lateral, and there are only 2 muscles that attach here. The first one being the trapezius muscle, and the second one is the deltoid muscle. Trapezius and deltoid. Trapezius is found on the posterior surface of the bone. It's around here on the back side of bone and attaches somewhere on the posterior lateral side. Here, this is the trapezius muscle. Just remember trapezius for stands for P, and it comes from the back side like this, and suggest something else you can do. For example, so this is the trapezius muscle on the posterior surface. Now we'll see deltoid muscle. It is where the anterior portion of the muscle is attached. Anterior means on the front, and it comes from the front side and attaches on the clavicle, on the periosteum. You know what periosteum is, right? The outer covering of a bone. Now we'll see how many muscles are attached to the medial third of the clavicle. There are 3 muscles attached to the medial third of the clavicle. These are sternocleidomastoid muscle, so this is the musculoclavicular head, and here the muscle attaches to the superior surface of the bone. Sternocleidomastoid muscle attaches to the superior surface of the bone where the musculoclavicular head is attached. Sterno for sternum, we can just say, and know that it is on the sternal side. Then there is the next muscle, which is pectoralis major, non-allot pect major, which is attached to the anterior surface of the bone, on the front side of the bone, we can say. And the pect major on the anterior surface of the bone, yeah, we can say on the chest. What we've got next is this subclavius muscle, which is attached to a groove found in the middle of the bone's inferior surface. Remember, we discussed the subclavius groove. It's attached to that groove on the inferior surface of clavicle. From there, the muscle, extends to both lateral and medial areas of the clavicle. It's on the inferior subclavius groove and extends from there to medial and lateral ends of the clavicle. Here on the inferior side, on the subclavius groove, here somewhere, and it extends from this point onwards to the both lateral and medial ends. We've just completed the clavicle topic, and that's it. Yay! Congratulations, but there's something left to do. It's just a key fact. We'll talk about fractures of the clavicle. These are the most common fracture site. You might have broken one of your clavicle bones when you were a child. It's the most common fracture in children and athletes. What's its cause is basically injury or trauma to the clavicle. Then the symptoms, for example, like if you're cycling and you fall off on your clavicle, on your shoulder blade, you just get a fracture. And it also is caused due to the compound compressing effect to the shoulder. Falling off is another major cause. Next we'll talk about the symptoms of a clavicle fracture, that are, obviously you'll feel a lot of pain, ouch, upon the shoulder and arm. Then there is, obviously, if you've broken a bone, there is swelling and bruising, and the part feels soft because the bone has been broken and there's nothing to make it hard. So a tenderness can be felt over the fracture site. And then if your arm is like tilting in here and there, it's dislocated, obviously that's the symptom. Who doesn't know the symptom of a fracture? It's so painful, right? Okay, so there are two ways of treating the clavicle fracture. One is a non-surgical way and the other is a surgical way. I'm not saying that you might get one fracture, but if you get one, which would you prefer, surgical or non-surgical? Obviously, the non-surgical, it's not about the preference, it's about the fracture type you've got. Let's discuss the non-surgical type. It's used to line up the clavicle. If it's not broken, then we use the non-surgical method. And another thing is to use an arm sling to treat it, fracture heals naturally. It doesn't need some machinery or something. I write it. Okay, let me correct this one. This is non-surgical. Sorry for the confusion. Anyways, and this is the surgical. I just wrote the opposite. Okay, fracture heals naturally in the non-surgical method. You don't need screws to get your arm healed. And surgical one is required when the fractured clavicle pieces are unaligned, when they're broken apart. So that fracture needs a surgical treatment. And with this treatment, the fractured pieces are screwed to a metal plate to keep them in a place during the healing process. And when the clavicle heals, the metal plate and screws are replaced by pins, which can be removed later in the future. It's painful. I wouldn't prefer that. It's not about preferences. Woohoo, that's done. That's off time now. Bye bye. You completed the gross anatomy of clavicle. Let me just take a break. It was so tiring to make a lecture for you guys. Bye bye. See you once again on my other videos. Follow me on Insta if you want to. I'm a huge potterhead for potter stuff and my vlog stuff. You can follow Acromioclavicular. For medical stuff is this. What are you waiting for? It's off time. Have fun. Don't forget to subscribe, like my videos, and share with your friends. Bye bye.